Osteoarthritis is one of the forms of arthritis. Osteoarthritis develops normally joints. It affects the membrane between the joints, neighboring tissues and areas. Actually, at the beginning, you get a frictional sound, which is normally taken by people as something wrong, and they don't give much attention to that. Later on, it develops inflammation, the swelling, then it will be noted. By the time you are in a very advanced stage of osteoarthritis. Osteoarthritis affects all type of people, irrespective of sex, age. We have seen that normally men after attaining the age of 50 and ladies after 45 get this disease. The percentage of patients among the women are the highest. On an average, 60% of the women suffer from some type of arthritis, mostly in the knee joints. Most people who are obese can easily become susceptible to osteoarthritis attack. The heavy weight your leg cannot support, it results in strain, and as a consequence, the movements become difficult. The fluid start drying due to aging. Now, aging has got several complications, and several systems in the body get weakened. And this is one of the places where the attack is very common due to age. As a consequence, the fluid gets dried. Then the cartilage membrane becomes shrunken, friction starts in the joint, and that causes damage to the tissues. Along with several enzymes also contribute to this phenomenon. Lipoxygenases, as they are widely called, COX-1, COX-2, and even COX-3 plays an important role. Among the lipoxygenases, COX-2, cyclooxygenase 2, is chiefly responsible for the inflammation of the membrane and cause of this disease. Leukotrienes, those are compounds which cause inflammation. Leukotrienes are also produced by cyclooxygenase 2 and 1. And leukotriene synthesis gets very rapid in inflammatory conditions. So this is one of the test points. If you can measure successfully the activity of cyclooxygenase compared to normal patients, and also the amount of leukotriene produced by some chemical methods, you can say you are in the starting point of osteoarthritis. But so far, no clear-cut test has been developed for measuring this, because the estimation of enzyme activity is very tiresome, is prolonged, it takes a long time, and the results are conflicting as a consequence. Clinical laboratories are not so prepared to undertake this test. This is one of the problems in the diagnosis of osteoarthritis. So finally, when the degradation starts, if proper attention is not given, even proper treatment is not given, the cartilage becomes fully damaged. Mobility becomes extremely difficult. People cannot walk, even they cannot sit, they cannot stand. Then finally, they have to resort to surgical treatments. In the initial part of the development of osteoarthritis, treatment is easy. We can control the disease if it is properly diagnosed. One of the best way to identify the disease, that if you are an advanced stage of 50 plus and if you have a joint pain, don't take it lightly. You use some analgesic, consult a physician, they may prescribe a non-steroid anti-inflammatory drug. Use it. When you withdraw, see that whether disease comes back. Sometimes you get cure. Actually, that is a problem for everybody. They think that it is cured. It's not a cure in arthritis. It is only a remission. And after some time, the affected drug is withdrawn, it will come back with a big bang. And then it becomes more complicated. So, if you get the disease for the second time again in the same intensity, it is time to consult a physician, probably a good ortho physician, and analyze your problem, undertake modern testing methods, and locate the site of damage, fix the issues, and undertake a long-term treatment. One should understand that if osteoarthritis set in, is not going to be cured immediately. You need long-time treatment. Drug therapy should be contained, but alternative treatments should be given and should be prolonged. Management is a very important aspect in the treatment of osteoarthritis. And if you are not properly following a strict regime, medical treatments, dietary restrictions, taking the right type of food, right kind of nutrients, you are going to be a problem for yourself. Eventually, if the damage becomes irreparable, you will have to resort to surgical methods. And remember, surgery is not, although surgeons and everybody claim 100% successful, very often most of the people have other complications. They are not coming back to their normal state of original condition by all means. But then you think, what are the reasons for the cartilage's damage? There are several reasons. Polyglycans, a group of compounds, they are the basic building block for the synthesis of collagen membranes, which are in between the bones. Along with lot of other chemical entities are responsible for rehabilitation of the tissues. Say, degradation of the collagen membrane in between the bones is not osteoarthritis. All the young members, all the people have the problem. Young man or woman, the degeneration of the tissues is taking place, but synthesis also taking place at the same rate. So they don't feel the difficulty. The moment the tissues are destroyed, it is synthesized back. With the advancing age, the rate of synthesis is slowed down and rate of destruction goes higher. So as you advance in age, this balance of equation is tilted towards degradation, and eventually you will be synthesizing at a lower rate, but by and large the destructive mechanism overtake it, and eventually your tissue membranes became reduced in number. You develop inflammation, you develop osteoarthritis, and you yourself get victimized by the disease. So these are some important points to be remembered in handling osteoarthritis.